I've had the professional fortune of watching the care for HIV evolve over almost 30 years. And 30 years ago, when we didn't have highly active antiretroviral therapies, there was very little we could do. In that era, the serious immune disorders and neurologic infections, cryptococcal meningitis, TB meningitis occurred, and we spent much of our time fighting that battle. Today, happily, we have a different battle, and it's less dire, but we have a large population of people living with HIV who are aging, happily aging, but we don't know what that aging trajectory looks like. We have some data to tell us that the nervous system will age differently when it has had long-term exposure to both antiretroviral therapies, which are neurotoxic in many cases, but also to sort of a chronic neuroinflammatory state. And so this is going to be a serious public health issue everywhere that persons living with HIV are, that we don't know the resources that they will need. We don't know the trajectories for their aging. And these are important questions to be asked, much nicer than dealing with a lot of neuroinfections. I do think it's important to note, though, that while most people are accessing therapies, those who are slipping through the cracks are still presenting with all of the same terrible infections that we saw 30 years ago. So clinicians in resource-limited settings have to be very attuned to both of those situations.